Today we're going to be talking about hip distraction, what it is, what it might do to you, and whether it might actually damage you. I'm going to talk about my own personal experience with hip distraction so you understand what it is, why somebody might do it to you, and why you probably don't want them to. So first of all, this is your hip joint. It's where your femur or thigh bone meets with your pelvis. This right here is the joint. If you're looking on the skeleton, here's your femur, here's your pelvis, there's the joint. When somebody wants to do hip joint distraction to you, they want to actually grab your femur and try to traction the femoral head out of the acetabulum. The theory is that you feel some kind of tightness or discomfort because the femur is actually too tight, it's being held too firmly into the socket. Ergo, if somebody can just traction that femoral head out, you're gonna feel magically better. The problem is nobody's really tested this theory, and physical therapists, doctors, massage therapists, personal trainers will all try to do this thinking that they're helping you get rid of that tight feeling. I had a massage therapist do this to my hip when it was feeling really stiff and tight and just off. He had me on the table and was just tractioning my femur out of the socket as best he could. And it took me several weeks to feel normal again because things felt really loose and poppy and snappy and unstable in my hip. I recently got a message from a woman named Whitney who had a similar experience when she went to a physical therapist. Whitney has cerebral palsy and has a lot of different things she's trying to work on, and the physical therapist thought they were helping and decided to do hip joint distraction and try to pull the femur out of the socket. She emailed me with a lot of fear because she was worried that she had permanent damage from what this PT did. Before you let anybody try to overpower your body to fix things, remember that the sensations that we have don't necessarily map to the language we have to describe it in a way that's productive. The whole concept of feeling tight is a really messy, dangerous, confusing one. A lot of medical and fitness professionals will tell you that if a muscle feels tight, you need to stretch it. This apparently simple piece of universal advice, however, is definitely not universal. Once you meet somebody who's super flexible, who can tuck their leg behind their head, tell you that they feel really tight in their hips, you know that this tight word that we apply to these sensations that we get from our muscles is not actually accurate. And if that's the case, you need to be judicious about how you apply stretching and massage to any part of your body that feels tight. Hey, I want to take 1 second to say a big thank you to Joseph K. and Rita P. Both of you gave $100 each via PayPal to support this channel, so thank you so much. To support this channel, use the donate link you'll find in the description box or the join and thanks buttons on YouTube. I also invite you to find me at uprighthealth.com and sign up for my newsletter, and find me on all the other social media channels with links in the description box. That'll keep you and I connected just in case YouTube decides they don't like what I'm saying in the future. All right, now let's get back to some hip distraction. Now you may be thinking, don't doctors, physical therapists, and even trainers have access to these special textbooks and special expertise that trains them to think in the right way and in the productive way that'll help me get rid of muscle tightness? Nope, I've been resting for years and I still feel tight. There you have it. Many years ago, I spent several years studying massage and bodywork, and the thing that got my attention was even the most senior level, most experienced teachers of massage often had no idea whether what they were doing to loosen tight muscles was actually gonna work. And the more honest of them would actually say, you know what, sometimes I just have no idea. And I've had clients who are physical therapists, practicing licensed physical therapists, who will tell me in all honesty and candor that what they learned in school doesn't seem to really help them understand how to actually help people with muscle problems. I once had a physical therapist fly from another state to come see me so I could teach him how to do some basic things like a straight-legged deadlift so he could turn on his totally atrophied posterior muscles. His back muscles, his hamstrings were so weak he was shaking just holding on to 10 pounds in his hands, and it's not like he was 90 years old. He was probably in his late 30s or early 40s, the age that I am now. The point is not to criticize him as an individual, but rather to point out that the body of knowledge that PTs and other medical and fitness professionals are working from is by no means perfect. I've actually heard fitness and medical professionals say with a straight face that they think when you do a hard martial arts kick, you're actually distracting the femur from the acetabulum. To believe that means you have no understanding of the physics involved in a kick. You don't understand the vectors involved, and you don't understand just how big your glute and thigh and other hip muscles are, and how much force directed out away from your body would have to be generated in order to overcome the stability of these giant muscles that hold the femur in the socket. Also, by the way, if you're gonna make a statement like this, you should have some good evidence of it. And as far as I know, nobody's ever been able to do an MRI or an X-ray of a martial artist throwing a kick to watch the bone actually distract from the hip joint. Which brings us back to hip distraction. Does it actually do anything? Well, obviously it can, because it made my hip and it made Whitney's hip feel really crappy for a little while. Could it be helpful for some people? I think yes, it might be helpful for some people, but I'm not sure in what case I would ever want to try it on anybody. From my perspective and experience, the feeling of stiffness and tightness in the hip is a result of the muscles around the hip joint not being balanced and several of them being weak and very stiff and inflexible. The solution to that is to actually figure out which muscles they are and then train them to be stronger and longer. Oftentimes that's going to involve the adductor muscles, which go from the bottom of your pelvis here and down along the inner thigh and even down below the knee. You may have some problems with the short adductors that attach higher on the femur, or you might have trouble with the hip rotators. There's a bunch of deep little muscles that all wrap all around that hip joint. You could just try to stretch them out by distracting the femur from the acetabulum, or you could work on those muscles and teach them to contract and teach them to extend and lengthen so that you have full control over those muscles. You may need to do more stretch and strength work for the posterior or lateral side of the hip joint to make things feel more balanced. Maybe you're going to be doing some frog stretches. Maybe you're going to be doing some side-lying leg lifts. Maybe you're going to be doing the leg lifts with your hip joint in full extension. Maybe you're going to be doing some squats. Maybe you're going to just need to learn to hang out in a squat position. Maybe you need to do some glute stretching. Maybe you need to do some really hard glute stretching. Maybe you need to do some glute activation work in a stretch position so that you build strength at every length. Maybe you just need to be out here and stretch out the adductors and the medial hamstrings. Or maybe you need to stretch out more of your lateral hamstrings to get things to feel a little better. It could be a lot of things, but the shortcut mentality of having somebody else just grab a hold and try to distract your femur from the acetabulum is not one that's very good in my opinion. Of course, if anyone has some halfway decent evidence that this is actually a useful long-term treatment for somebody's hip pain, then I'd love to hear about it in the comment section down below. Show me a study, show me any kind of research that demonstrates that this has even some theoretical validity. Actually, no, theoretical validity is not enough, but if you have some of that, just show that to me and then show me whatever else you got. Drop it in the comment section down below. Now, Whitney was really worried that doing hip joint distraction might cause permanent damage, and I don't personally think it does cause permanent damage. Remember that human beings are able to survive all manner of crazy traumatic injuries. People can get in motorcycle accidents, car accidents, parkour accidents. They can be in terrible skiing and snowboard accidents from great heights, and they still survive, and they still are able to regain function. Doing something that stretches out soft tissues like this will probably not damage you forever. You're just going to have to figure out how to restore proper muscle function to regain more stability in the joint, which is why I think you should just skip this whole bit about somebody overriding your natural muscle tension and learn how to restore natural sensation by restoring control and connection to the muscles around the hip joint. Of course, I'm not a doctor, so this is not medical advice. If you want a doctor's opinion, go find a doctor who has the opinion that you want and then go listen to them. If you want to improve your overall hip mobility and control, check out the Healthy Hips program, which you'll find at uprighthealth.com/DIY. For a free follow-along workout to help you with your hips, be sure to check this one out here. If you want to support this channel, use the donate link you'll find in the description box or the join and thanks buttons you'll find on YouTube. Like, share, and subscribe with the bell notification on. As always, I hope you remember that pain sucks, life shouldn't.